Hola, mi nombre es Ubaldo Reyes. Bienvenidos a mi canal Radiofísica con Baldo. Este video es el segundo que aborda el tema de aseguramiento de calidad paciente específico cuando tenemos un PTB largo en un equipo de tomoterapia.
Patient-specific quality assurance in long PTV. On the first video, we gave an introduction for this process, and we demonstrated how we take upon quality assurance generation in the planning station of TomoTherapy. In this second video, we'll demonstrate how we make those measurements and give our final comments in regards to this topic. Before beginning with this second part, we'll make a small recap in regards to the first video. For that, we'll only show how we release the treatment operations that we're going to deliver on the. In this case, it'll be exclusively specific patient QAP number 2. More so, we'll explain as to why we're only delivering this quality assurance and not the others. Once that's been said, we begin the second part for this job. How we measure quality assurance in a long PTV. First of all, what we need to know is where our green laser is located. For that, we can count on the transversal plane, and that's how we identify on what slice is our green laser located, on axis Y. In our example, the green laser is located on slice 110. If we subtract the slice where the green laser is located minus the slice where our first center is located and multiply by the width of the slices, we get a distance of 18.9 centimeters. We know that the red laser, which is our treatment laser, has a limit of more than less than 18 centimeters of displacement, as the green laser on the axis Y direction. Having this in mind, it would be impossible to deliver patient-specific QA number 1 in TomoTherapy. Let's analyze the QA number 2. In this case, the center is located on slice number 113. If we subtract 113 minus 110 and multiply by the width of the slice, we have a value of 0.9 centimeters. So this QA is able to be delivered in TomoTherapy, and this is exactly why we do many sessions to deliver QAP number 2. Let's analyze QAP number 3. We know that the center is on slice 179. If we subtract this with 110 and multiply by 0.3, we obtain a distance of 20.7 centimeters. So this QA cannot be delivered in TomoTherapy. Having this in mind, now it should be clear as to why we are only making an image registration on QAP number 2. More so, we'll begin to deliver this QAP number 2. Now, what we need to have in mind is the distance that exists from center to center in ArcCHECK, because those are precisely the distances we're going to displace when we do the measurements in TomoTherapy. And the process for knowing those distances is very simple. We know that the center for QAP number 2 is on slice number 113. And we also know that the center of QAP number 1 is on slice number 47. We then subtract these two values and we multiply by the width of the tomograph, which in this case was 3 millimeters. And we have a result of 198 millimeters. This same rationality is applied to obtain the same distance between QAP number 3 and QAP number 2. It's important to have in mind these results because we are going to use them furthermore. What we do next is go to the TomoTherapy operation station and initiate the process for image registration. In this case, we first select the area we would like to visualize. We do a slice width of 3 millimeters and prepare the TomoTherapy. After that, we go inside the bunker to align our check. We'll head to the ArcCHECK station and begin the corresponding software, which will make the measurements with. It's reading the background radiation, and prior to that, we go inside the bunker to prepare the equipment to begin the image registration. Once this image registration is done, what's next is to deliver QAP number 2. We'll visualize how the data is being gathered on the corresponding software. Once the data has been gathered, it's important to stop the beam and begin to analyze gamma index. For this first QAP number 2, using index gamma 33, we obtained a result of 96.1% for the quality assurance measurement. Now we'll deliver the QAP number 1. For that, the first thing we'll do is upload it to our ArcCHECK station, putting all the corresponding values, and the most important thing is to go inside the bunker and do the following. Manually displace our check in a way that the red laser is on the center of our check. We have to be very careful because we must not displace on Z nor X, only on axis Y. We check both of our check sides, and what's next is the core part of this process. With the help of the panels, we displace 198 millimeters towards inside on Y's direction to deliver the QAP number 1. This is the distance that was previously calculated. Once that's done, we let the system know we're ready to begin the measurement. Once again, we wait for the data to be gathered for QAP number 1. Once the data has been gathered, we once again do the gamma analyzation 33. We had a result of 100%. Last but not least, we upload QAP number 3. We give the system time to upload, and what we do again is go inside the bunker and displace in Y direction in a manual form. In a way that the center of our check aligns with the red laser with the TomoTherapy. Once it's aligned, with the help from the panels, we displace 198 millimeters in Y direction, but towards the outside. It's the distance that once was previously calculated where the other center is located for QAP number 3. Once that's done, we let the system know we are ready to begin the third measurement. We let the system make the data gatherings for this QAP number 3, and finally make a gamma index 33, which in this case gave us a result of 99.7%. What's left is to verify our data gatherings. On one hand, we have the patient-specific QA from the planning systems, And on the other, we have our data gathered from the measurements with the result of each and every QAPE. We can make a table where we have the total detectors, the ones that passed the test and the ones that failed the test. Finally, we obtain the percent of detectors that passed the test versus the number of detectors to obtain an index gamma of 3.3, an absolute dose of 98.4%.
Elaborar un aseguramiento de calidad paciente específico cuando tenemos un PTB largo es un proceso complicado. Sin embargo, desde mi punto de vista, sí es recomendable realizarlo para darle mayor calidad a los tratamientos que estamos ofreciendo a nuestros pacientes. En el Centro Estatal de Cancerología en Durango, México, regularmente los elaboramos los días sábados, que es cuando tenemos disponible el acelerador lineal al 100% para realizar mediciones. No debemos perder de vista que debemos cuidar nuestros dispositivos y no exponerlos innecesariamente a radiación, en este caso ArcCHECK, para darles una vida útil mayor. Espero este video sea de utilidad, denle like, suscríbanse a nuestro canal y nos vemos en el siguiente video. Muchas gracias.